Everyone. This is Dr. Garima Sharma. I am Lab Director at Banarsi Das Diagnostics, New Delhi. I was formerly a resident at Lady Hardinge Medical College and Hospital, and then I did my senior residency from VNMC in Satyajit Hospital. Today, I will shed some light on the topic blood tests in pregnancy. So, if a woman is pregnant, what she does is the first test which she does is UPT. So, what is UPT? That is urine pregnancy test, right? So, once she is positive, she immediately goes to a gynecologist. She consults a gynecologist, right? So, when she consults a gynecologist, she writes few set of tests to her in the initial part of her pregnancy. Okay. Now, what all tests are those? Those tests are very important for her and she needs to get it done as soon as possible, right? So that she can go back to the gynecologist and consult whatever if some pathology is there or something, some values are not correct. So she has to go back home. So she doesn't have to delay for that, right? Okay. So the very first test which she has to get it done is CBC. Now, what is CBC? It is a complete blood count. So if the name suggests complete blood count, so what all tests we can see there? So if I talk broadly, then hemoglobin, WBCs, which are white blood cells. So what are white blood cells? So white blood cells consist of neutrophils, eosinophils, lymphocytes, monocytes, basophils. So this will tell the status of your white blood cell count. Yes. And what else you can see in WBC? Sorry, not in WBC, CBC. So what all you can see in CBC? The platelet count, right? So the platelet count can also be seen whether it's low, normal, high. So accordingly, the woman will be treated for that. Now we come to next test. The next test is random blood sugar. Okay, so we see the quantity of sugar level in blood of a pregnant woman. That is very, very important, whether she's diabetic, pre-diabetic, or normal. This can be checked through this test. Next is blood grouping, very important, and not only for a female, for a male also. So we have to check male and female blood group to see the compatibility. So whether there is a factor called rhesus factor, so whether it's present in female as well as in male, so accordingly the patient will be treated for that. I will not say patient, but a pregnant woman will be treated for that. Then urine test. A urine test tells a lot of things. A lot of tests are there in a urine test through a strip method, through microscopy, and we advise culture also. So from culture, if we get a culture done, so by culture, what we can find out is that whether the pregnant woman is not having infection, any sort of infection. Then HIV, HBsAg, HCV, VDRL, these tests are very, very important. So because the pregnancy can be complicated. It comes out to be a complicated pregnancy if any of these tests, God forbid, are positive. Then thyroid. Thyroid is very important. The thyroid function test. Thyroid function test consists of three tests: TSH, T3, T4. So all three tests are tested in thyroid profile. So the thyroid profile is conducted. And then rubella, IgG, and IgM. So these sort of tests are important, mandatory in initial stage of pregnancy. Then we come to a pregnancy which lands to 11th to 13th week. Right? So if when she touches 11th to 13th week, she's in that phase. So at that time, double marker is very important. Obviously, ultrasound is there, ultrasound level 1 and double marker. So since we are only talking about the blood test, so I will be confined to the test. Then in 18th to 20th week, triple marker and quadruple marker. are important. Obviously, ultrasound, level 2, and anomaly scan. Very, very important. Then we come to 28th week. So 28th week, what all tests are important? The very first test which is important is GGT. So GGT blood test is important. Now what is GGT? Gamma glutamyl transferase. So gamma glutamyl transferase is an enzyme, it's a liver enzyme. And its status in blood is to be tested. And it is important to see whether the liver is working fine or not in pregnancy. Now the pregnancy has come to a fast stage. And how we do it? By giving 75 grams of glucose at this time. So this is important. And then hemoglobin. Again, hemoglobin is very important in pregnancy. If hemoglobin gets low or uh, if it gets low, it becomes very difficult. So we have to check hemoglobin levels. Very, very important. The whole pregnancy is very, very important. And then urine, again, routine, microscopy, culture, again to see any infection. Because this time, any infection is there, it can be carried to the baby, the developing womb. So again, fetal growth is important. So the fetal growth scan, again, ultrasound is required at this time. So all these tests are very, very important in pregnancy. Right? So, any of the tests which are now being added in the schedule can be taken care of, but these tests at least are mandatory to be taken care of. Like, they are needed. They are very much needed for a pregnant woman. Yes. So, what else? If I talk about this pregnancy part, this is very, very emotional part of our life. Of our life, it means the pregnant women, especially the woman who's getting pregnant for the very first time. She doesn't know. Second time, you actually know that what all tests you have to get done. But first time when you're getting pregnant, it is very the women is very afraid, काफी डरी हुई होती है, उन्हें पता नहीं होता कि इस वक्त हमें क्या कराना चाहिए, क्या नहीं कराना चाहिए। काफी ऐसे टेस्ट होते हैं जो वो भूल भी जाते हैं, उनको पता नहीं होता कि ये टाइम हमारा निकल गया और हमें पता नहीं चला, हमारा टेस्ट मिस हो गया। तो अगर ऐसा भी कुछ टाइम है, तो अगर आपका कोई टेस्ट मिस भी हो जाता है, तो नथिंग टू वरी अबाउट। कभी भी पैनिक नहीं करना कि बेटा ये टेस्ट मिस हो गया, कहीं मेरी डेवलपिंग बेबी को कुछ प्रॉब्लम ना हो जाए, कुछ हो जाए, नहीं। यू शुड नेवर पैनिक। कोई टेस्ट नहीं हुआ किसी भी वजह से, you should always talk to your gynae. Your gynecologist will tell you, will counsel you that whether you want to get these tests done again, or they can be missed, or they can be taken care at the time of ultrasound. So this doesn't mean that we can easily skip over the test and we can directly go to an ultrasound and वहाँ पे check हो जाएगा कि ठीक है नहीं. These tests are important, but the only thing which I want to emphasize on is that you don't have to panic कि कोई भी टेस्ट हमारा मिस हो जाए. But जो भी टेस्ट मैंने बोले हैं, ये कम से कम these tests every pregnant woman has to get done. She should not miss this test. And at the right time, like I told you, the initial stage of your pregnancy, then 11 to 13th week, then 18 to 20th week, then 28th week, then afterwards. So these the weeks ranges I've given, these are important because at this time the baby is developing. The womb is developing to a small, first of all it's small pea, then it becomes lemon size and it becomes avocado size, and then the growth keeps on increasing. So at that time this thing is very important. If I talk about blood tests in pregnancy, they play a very important role, very, very important role. Because these blood tests, they can tell you a lot of things which can be picked up during the pregnancy time and can be, if any problem is there, if there, there is any increase in any range or decrease in any range, or if it's normal, then it can be easily treated according to that. And obviously, since hemoglobin plays a very important role, so hemoglobin check is very, very important. Women should always get a hemoglobin check at, I would suggest, in all the three times when she goes for a blood test. Like initially, then at 11th to 18th week, then at 28th week, hemoglobin is must. And these tests, which I told you, that HIV, HBsAg, HCV, BDR, these tests are also very, very important. They need to be checked and done at the right time. And before that, your delivery is not possible if these tests are not being conducted. So I would suggest that whenever a woman gets pregnant, she knows that she has missed her cycle, right? That's how she'll know that she's pregnant, that she has missed her cycle. What the very first thing that she does is she does UPT, as I already mentioned. What is UPT? Urine pregnancy test. So when she does UPT, she straight away goes to gynecologist. So when she straight away goes to gynecologist, she writes two set of tests, which I told you. These tests can be, you know, at that time only can be given to any lab, or if you want a few days time, you can take that time, you can get yourself prepared, because uh, immediately you're not prepared for everything. Once you get, for the first time when you're getting pregnant, and even the second time also, whenever you know that you are pregnant, right? So you're not ready for the test. So you keep on delaying it. कि करा लूंगी कोई नहीं अभी कुछ टाइम बाद करा लूंगी just delay should not be there. I would say, why I'm emphasizing on these things? You might be thinking why I'm saying all these things that ये delay हो जाता है ये हो जाता है, because people come and they come with this problem that इतना टाइम हो गया हमने एक भी टेस्ट नहीं कराया, इतना टाइम हमारी डिलीवरी पास आने वाली, there are many people, there are many females who come and say हमने एक भी टेस्ट नहीं कराया अभी तक, पर हमारे को टेस्ट कराना नहीं है, हमें सुई से डर लगता है, बट नहीं, ये आपके और आपके बच्चे के लिए, होने वाले बच्चे के लिए बहुत जरूरी है। तो आप एक बार जाते हैं, आप टाइम लीजिए, आप प्रिपेयर करिए, टेक 2-3 days टाइम, आप प्रिपेयर करिए अपने आप को, और प्रिपेयर करने के बाद get yourself tested for this. It's just a minute. It's just a matter of few minutes, not only few minutes also. So you just have to get your blood drawn, and the job is done. So this is what I want. I really want to emphasize on, and uh, this pregnancy part is very, very emotional, and lot of emotions are attached to it, right? So you should always be, very enthusiastic about it. Not you should not feel that oh ये क्या हो गया, मैं कुछ कर नहीं पाऊंगी, मैं कहीं जा नहीं पाऊंगी, or something of that sort कि मैं ये नहीं कर पाऊंगी, मैं बाहर नहीं होंगी. No, you should be active until and unless your gynecologist has suggested for a bed rest. You should be very active. So this time is never going to come again. This is very, very, very special time for a female, and she's in a phase of becoming mother. This thing is very, very, touching and very important for a female. And this time never comes again until you're getting pregnant again. So before that, this time is very, very precious. So that's the right word, precious. So Mm, that's all for today. And if I say that a take home message, if I give that take home message is when you're getting pregnant, when you're going to a gynae, get these tests done, prepare yourself, and get your test done. Once you get your this thing done, you will be relaxed after getting your reports and all, and you know the cycle. Now you know that yes, my gynae has told that after this these many weeks I will have to come again. After these many weeks I have to come again. So that reminder can be set. And this parenting app which you are using, Baby Chakra, they also they're doing very nice job in sort of giving so many good tips and the reminders, and gynecologists and pediatricians they have on board. So you can always follow them. This app is a wholesome app for every uh, pregnant woman and mothers, the moms to be and moms. So that's all. And I hope this session was helpful for you. Now, if you have any questions, you can please feel to ask any question. Okay, so the very first question is, how is the test for blood sugar done? Is that the same for? Yes, blood sugar done. So the blood sugar test is done through blood. When you withdraw blood, and it can be done anytime in a day. See, there are three types of blood sugar tests. One is fasting, other is PP, that is postprandial, and the third one is random. Fasting, the mother has to be empty stomach. PP after taking food, and random anytime in it. So that's how you can get your blood sugar levels checked. Okay, now how blood sugar affect a newborn? See, the newborn can be affected by blood if blood sugar test, like how it is affected. See, when the sugar level is high, okay, so it means that the female, I mean the pregnant woman, is diabetic, and if she's diabetic, the developmental delay can be there for a newborn. So this the diabetic thing should be checked. When is glucose screening done? Glucose screening is done in 18th to 20th week. In between this week, glucose screening can be done. Who should be tested for tuberculosis? Okay, so positive family history for tuberculosis. If there is any person who has if female is living with some person in the family who has positive history, I mean the exposure history is there, so these two has to be taken care of. What if I'm not immune to rubella? If you're not immune to rubella, then it becomes a little difficult for the developing fetus for the development. I mean, the developmental delay is there if you're not immunized to rubella. So, though if you are, your gynecologist will tell you that if you are not immunized, then is there any? past history or any other cesarean history you have or something of that sort, then the gynae will suggest you that what you have to do next. But if you're not immunized to rubella, then that is a question of a problem. What is 10-week blood test for in pregnancy? What is 10-week blood test for in pregnancy? Okay. So this question, I will say that I've already told you that 11th to 13th week. Before that, you have to get all the tests done, right? So what is 10-week blood test for in pregnancy is that I would say that once you're positive, so before 11th week, whatever tests you're going through, whatever test, I mean the sort of test the list of tests which I told you, if you're going through those tests, they all are important in 10th week. Like before 10th week you have to get them done. And what all tests are those? I told you it's CBC, urine, blood grouping, random blood sugar, HIV, HBs, AG, HCV, VDRL, typhoid, thyroid, rubella, everything. What are the other conditions that can be monitored through pregnancy tests? Okay, so there are many other conditions also which can be monitored through pregnancy tests. What are those? So, if there is any genetic abnormality that can be tested, but these are all higher end of tests. Any other pathology going on inside can be tested. So these are the tests which can be monitored. They are all advanced set of tests. What routine screenings should be performed on all pregnant women? Routine screenings, see, the routine screening part which has to be performed are the normal these tests, which I've already discussed in my chat. If you listen to the chat again, you can listen to it. That all these routine things I have already covered. That these should be performed on pregnant women. And birth defects, four main causes. First, diabetes. Second, thyroid. Third, any positive history, any family positive history for hypertension, or any abnormal genetic profile of family. So that's all for today, and I hope it was a helpful session. Thank you so much, and have a great day.